Well, good day to you. This is Greg Downing with Texas Medicare Advisors here outside of Austin, Texas. And I'm a licensed insurance agent specializing in people that need to sign up for Medicare and help them find the right Medicare plan at the right price. Now, if you're like most of the people I work with, you're a little confused and irritated because the more you read about Medicare, the more confused you get. So I get it. So that's okay. So this video is just a simple video that says, here's exactly what I would do if I were turning 65 and signing up for Medicare today. You don't really need to know how much I know about Medicare. Most people just want to know how much it costs, what the benefits are, and when can I get it done. So that's what we're going to do today. So the first thing you have to do regardless is you've got to sign up for your Medicare Part A. Now, Medicare Part A is your hospitalization coverage. Great thing about it, it's free as long as you've earned your 40 credits, which is basically 10 years of working. So it's really not free. You've paid for it your whole life. Now, Medicare, Part A doesn't cover everything because when you're admitted to the hospital, you have a $1,600 deductible. And that's not per year, that's per benefit period. So if you got admitted to the hospital in say, March, and then you had to go back in July, you'd have to pay that twice, right? There's some other weird things, like you have to pay for your first 3 pints of blood. Not really sure why or who came up with that, but that's just part of it. And pints of blood are expensive. And if you're in the hospital for an extended period of time, you have daily co-pays you have to make that are up to $800. And then if you're in there for more than 150 days, there is no coverage whatsoever. So that's something to think about. Most people don't like those exposures. Now, the second thing you got to get your Medicare Part B. Now, Medicare Part B, that's your preventive services. You visit the doctor, medical equipment, if you've got cancer and you need chemotherapy, that's covered under your Medicare Part B. Now, you have to sign up for this. This doesn't happen automatically unless you're drawing your Social Security benefits. So I recommend you sign up 3 months prior to your 61st birthday. Now, you can sign up later, but I don't recommend that. And here's the crazy thing is you have to sign up through Social Security for your Medicare, and you have to have a My Social Security online account to do that. Because of COVID, Social Security is way behind on everything. It's taken about almost a month to get your Medicare Part A and B card once you sign up. Now, Medicare Part B is not free. Currently, the cost in 2023 is $164.90 a month. That's what most folks will pay. But if you're a higher income earner, the government's going to charge you more because that's the way they roll. The more you make, the more they're going to take. So if you do have a high income, we need to talk about this so we make sure we know what your cost is going to be. All right, so Medicare Part B has a $226 deductible. After that, Medicare is going to pay 80% and you pay 20%, which is good, but the problem is there's no cap to that. There's no out-of-pocket maximum. So if you get diagnosed with cancer and you need chemotherapy and it costs $100,000, guess what? You got to come up with 20 grand, okay? Most people don't like this. So what do? How do we cover those exposures in case you're riding in that ambulance, something bad happens? Well, most of my clients get what is known as a Medigap plan or Medicare supplement plan. Now, these plans, what do? Well, they pay for that Part A deductible, the $1,600 if you need that. Any of those Part A co-pays cover it, pays the 20% that Medicare doesn't under Medicare Part B. The only thing that these plans don't cover is that $226 deductible. And again, that's an annual deductible that you would be responsible for. So that gives you pretty dang good coverage once you get a Medigap plan or Medicare supplement. It's the same thing, 2 words, just to make things more confusing. Now, you also are going to need to get a Medicare Part D. That's a drug plan. All right, so how do you do that? Well, Oddly enough, there's 27 different plans to choose from, and the only way you know which one's going to be best for you is we get a list of your prescriptions, put them in our magic machine, and it will show us, based upon your prescriptions, where you want to get your drugs, what the best drug plan is based upon your premium and your monthly copays. Now, some people say, well, I don't take any medications. I don't need that. Well, yeah, you do. Because if you don't get one now and you decide to get one later, you're going to have to pay a penalty, and that's going to cost you more money than you want. So there are very inexpensive drugs, $15, $16 plans out there. We want to go ahead and get signed up for one of those regardless. Now, additional coverages. Well, Medicare does not cover regular preventive dental, or also same thing with vision and hearing. So if you want to cover those, you'll have to get additional plans that cover these for you when you get on Medicare. Now, here's one thing that I think is very important. People ask me, what else do I need? And I always recommend get a little cancer insurance. Why is that? Well, if you ever been diagnosed with cancer, have to deal with that with family members, it can turn your world upside down. And does Medicare cover cancer treatments? Absolutely. The problem is I currently have several clients right now that are taking these very expensive oral cancer medications that cost $10,000 a month. And even with a drug plan, they're still having to come up with thousands of dollars to cover the cost of the copays on these treatments. So I highly recommend you get a little cancer insurance, maybe $10,000, $20,000. It's not that expensive. It's about $1 a day. And I don't have to statistically tell you the realities of cancer. If you look just at my family, my mom, my dad, my brother have all had cancer. My wife's mother, dad, and brother have died from cancer, and both of our sisters have had cancer. So it's not like the odds you'd have to convince me of that at all. So I currently have $20,000 of cancer on myself and my wife because I know it's a reality and these things can happen. So that's one other thing I highly recommend people look at. Of course, you can do whatever you want to. Now, one other thing is I recommend you start thinking about a long-term care plan for yourself if you don't already have one. Why is that? Well, Medicare doesn't pay for long-term care. Most people think it does. It does not. And studies show us that 70% of us, once we get to 65, are going to need some form of long-term care. If you'll see that good-looking guy right there in the middle, that's my dad. Or he was. I guess he still is. He lived with me for the last 4 years of his life, with me and my wife. Prior to that, Mom and Dad lived in Lubbock at an assisted living home for about 3.5 years. And he never had any type of long-term care. So we had to pay for everything that we treated him. And that's a picture at the Age of Central Texas, which is an awesome adult daycare. And that's Lauren over there. I took him there 5 days a week and had to pay cash for all that. So just think about when we get older, we're going to pay a lot of money for health care. And you can either pay for it out of your savings, or you can figure out ways to leverage your money and simply let some of these things be covered by different plans. All right. So that's a picture. So just think about that. At some point, you want to focus on coming up with a strategy for that. All right. Let's switch gears here a little bit. Joe Namath. What in the world is Joe Namath talking about? Free. You're just not getting everything. Well, he's talking about Medicare Advantage plans. Now, what exactly is a Medicare Advantage plan? Well, currently, what we've talked about is original Medicare. You get a Part A, Part B from the government, drug plan, you get a Medicare supplement. This allows you to see any doctor, hospital in the country without a referral, as long as they take Medicare. Now, over here, a Medicare Advantage plan, what are these? This is where the government has realized that, wow, we got to support up Medicare and figure out how to keep this thing rolling because people are turning 65 every day and they're not dying. They live for a long time. So what they do is they contract with insurance companies and they say, hey, we'll pay you X amount per month per member that you can transition from original Medicare over to a Medicare Advantage plan, and we will pay you, and you provide the same similar service that original Medicare does. Now, the thing that people like about these plans is a lot of them have a zero premium. They don't cost anything other than your Medicare Part B. Well, that's awesome. Also, they have dental coverage, and they'll have some vision and even hearing coverage. And it looks like that old boy right there could use a little of all that, right? And so they offer these things up front that are very appealing to people that Medicare doesn't. And you hear about the flex plan where the government's going to give you money. Those are through these advantage plans. Also, some of them will give you part of your Part B premiums back based upon certain plans. Now, oh yeah, and they also will offer, rides to your medical appointments. Yeah, what's funny about most of those is that they only go one way. They won't pick you up and drop you off. It's just they'll either drop you off or pick you up. So you still have to have somebody pick you up. So these are appealing benefits up front, but what you have to pay attention to is on the backside. Remember, you can go. What people get concerned about is out-of-pocket maximum. You look, most of these Medicare Advantage, and there's lots of them, and this is just general information, not specific, but they'll have maximum out-of-pockets up to $6,000, $7,000, $5,000 if you really get sick and things happen. And you can see this chart and you can see the difference, but a lot of people are worried about who they're able to see. They have to get approval for all their procedures, and you can also be penalized if you don't get pre-certification and you have to wait on them, and you're limited to the doctors you can see. And like you'll see that last slide, Mayo Clinic is not in any Medicare Advantage, or neither is MD Anderson to my knowledge as of the recording of this. So you just have to be very careful when you are shopping for these plans. Also, they pay us a lot more money to sell these Medicare Advantage plans, and you just kind of follow the money on that. But we do both of them, whatever meets your needs, but you just need to be aware of each of the different parts. Okay, so what's your next step? Well, I need a list of your medications so I know what is going to be the best or most suitable Medicare Part D drug plan for you. So where you get your prescriptions makes a difference, and what they are. So once I get that, I can start working on that to find a plan for you. The other thing that we have to do is we have to get what's known as a scope of appointment from you, which is simply you're giving me permission to talk to you about Medicare plans. And then we have to keep that on file for 10 years. And the reason we have to do that is there's a lot of unscrupulous people out there that are trying to switch people that don't have your best interest in mind. So anyway, a lot more compliance on that area. We've got to do things like record phone calls because of all these bad players. Anyway, we have to get that. Okay, so you get those things to me, then I can do a comprehensive analysis and a proposal just for you, and then we'll set up a time and go over this stuff. So again, my name is Greg Downing here in actually Leander, Texas, where our office is, with Texas Medicare Advisors, and I just cannot wait to help you get signed up for Medicare and get the right plan at the right price. All right, have a blessed day. We will talk to you soon.